Daniel Augustine's family is large and loving, but it was this girl right here, Allison, who led Daniel to realize it was time to get serious about his back pain.
The pain had gotten so bad that I couldn't even take my dog out for a walk. I would take her out in front of the house. As small as she is, she's very strong, and she would pull my wife down, so I have to take her out. And the best I could do would be to take her out on my own lawn and then bring her back in, and even that hurt. Just standing up, I couldn't stand up straight. I couldn't walk more than a few steps before the pain would start, and the more I walked, the worse the pain got. And I really was getting to the point where all I wanted to do was sit down all day, every day, really. That's how bad it was getting.
This fall, he met with doctors, eventually finding neurosurgeon Dr. Gregory Thompson at Penn State Health St. Joseph.
His MRI scan showed really tight spinal stenosis. And spinal stenosis is just a fancy word for narrowing of the spinal channel where the nerves run. So he was having nerve compression or pinching of the nerves in a pretty focal area or specific spot in the spine. There's 5 bones that make up the lower back, and his stenosis was between L4 and L5, which is the most common area we see for stenosis.
Daniel needed a lumbar decompression operation.
So there's 5 bones that make up the lumbar spine. This is 5. So at 4 and 5 is where Daniel had the stenosis and so forth. And we like to see a nice curve, sort of backwards curve to the spine and so forth. And in Daniel's circumstance, what was happening is these facet joints here were enlarging and the disc was bulging, and this channel, the spinal channel, was becoming severely narrowed. And so in his circumstance, all we need to do then is a small operation tailored right over L4 and 5, basically maybe a little bit more than an inch here, to remove this bone and the ligament here and work from inside out to open the nerve channels to take the pressure off the nerve.
I had the surgery on September 16th. It's a date I will never forget. It took him 3 hours altogether. But for the first time that same day, I was up and I was able to stand up straight without pain. And boy, was that great.
For most patients, they also will report getting out of bed soon after surgery, that they don't have that pain, that disabling nerve pain going down the legs, that they're able to walk, and they start to notice that they can walk more upright instead of tipping forward to try to get relief of that pain. They're more functional and more able to walk, and just, they feel more comfortable.
His staff was fantastic. When I went to get the staples removed, it was his nurse removing the staples. And I was just so excited about being able to stand up straight and being out of pain that she said, "Wait, I have to go get Dr. Thompson. He should see this." So she went and got him, and I relayed to him how great I felt, and he was very happy about it also.
It's been 4 months, and Daniel remains pain-free. The only one happier about that than Daniel might be Allison.
To be able to go around the block with her, and it was really great. I don't know how I can describe it. I felt so good. It was an amazing difference.
The pain Daniel had been feeling can be a process of aging, but Dr. Thompson says some people are more prone to it based on their anatomy. Dr. Thompson expects Daniel will continue to be pain-free and won't need any future procedures.